Nearly half of all Americans have at least one preventable diet-related ailment, including heart disease, type 2 diabetes, and obesity.
Yes, and many chronic diseases can be reversed or even cured through diet and lifestyle changes. But as News 4 Tucson investigator Matthew Schwartz reports, most medical schools don't provide enough nutrition training.
This is Steve Nath when he weighed 370 pounds. This is Steve after losing 130 pounds in 18 months. The 56-year-old Benson resident says if he hadn't changed his diet and exercised, he'd be dead by now due to multiple health problems.
COPD, type 2 diabetes, heart issues, kidney issues, high blood pressure that had been uncontrolled on a multitude of meds.
Before Nath found Oro Valley family physician Ted Crawford, he had seen 6 doctors. They put him on 18 medications.
And how many of them talked to you about nutrition?
Nobody talked to me about nutrition. It was always take this, take this, take this, take this.
I had high blood pressure, high cholesterol, I had type 2 diabetes.
46-year-old Jason Walden saw 4 doctors previously.
What did they tell you about what you're eating, nutrition?
No one ever mentioned anything about it.
Several doctors have told the News 4 Tucson investigators that the lack of nutrition training at many medical schools nationwide is a travesty. Students learn a lot about prescribing pills, about treatment, and performing surgeries.
How many hours of nutrition training did you receive in medical school?
We probably had 15 hours, I'd say, total during our entire curriculum.
I received 30 minutes of nutritional training when I was a medical student in the late 80s.
The fact that we ignore these lifestyle behaviors and don't address them at all, I think to me is a borderline malpractice. I mean,
Dr. Sarai Stancic practices lifestyle medicine. The New Jersey-based physician is featured in a new documentary called Code Blue. The film calls medical school curricula antiquated.
And we have the knowledge and understanding today to prevent 480,000 deaths. And extraordinarily, we don't speak to this.
The congressionally mandated minimum for medical school nutrition training is 25 hours over 4 years. A study by the University of North Carolina's Nutrition Research Institute showed that 71% of med schools do not meet that minimum.
Over 80% of all our chronic medical problems are caused by our lifestyle, and primarily our poor diet. And we get no training in that field, so we're not taught to kind of promote that lifestyle.
Why historically has there been so little nutrition training in medical schools?
It was just that it wasn't felt to be a major determinant of health at the time.
Dr. Sean Elliott is the Associate Dean for Curricular Affairs at U of A's medical school. He says science has evolved, as has doctors' understanding of the factors that impact on disease.
Fast forward now in 2019, that understanding has increased significantly, but people and colleges are still navigating how best to teach nutrition.
Elliott says there's been a concerted effort at U of A to increase nutrition training, and that its medical students now receive at least 40 hours.
All healthcare providers have got to embrace the concept of holistic health. Nutrition, physical, emotional, spiritual, however you define that.
Steve and Jason are doing well since switching to a whole food, plant-based diet.
It's made a world of difference to hundreds of patients that I've seen.
What's your advice for patients? What should they ask their doctors?
Doctor, what should I eat? I mean, what's the best way I should eat?
Dr. Crawford works at Northwest Allied Physicians, but is speaking for himself. Regarding lifestyle changes, he said, "It is sad that physicians are not offering the most powerful tool we can give patients to actually reverse their chronic medical issues. None of their prescription medications can do that." Investigating for you, Matthew Schwartz, News 4 Tucson.